topic of discussion that we are going to deal right now is we are going to talk about focal segmental glomerulosclerosis. So the pattern that we will follow while discussing this topic is, what we'll do is we'll go initially through this point of notes, right, all these contents, the diagram from Robbins, and then what we'll do is we'll recall everything that we have studied from the content of our first aid. So without delay, let's move directly into the topic. So here the thing that we need to do initially is we need to go through the words, right? We are under the topic of nephrotic syndrome, and under that nephrotic syndrome we are talking about focal segmental glomerulosclerosis. So what is this focal segmental glomerulosclerosis? From the name it's clear that focal, what does focal means? Focal means few glomeruli only are involved, not all glomeruli are involved. So focal, what does focal means? From F, focal, and from F, that is few glomeruli are only involved, right? And what does segmental means, right? Okay, segmental means that when we see individual glomeruli, right, individual, that few number of glomeruli which are affected, we'll see that in that individual glomeruli we'll see only there will be patchy involvement, right? That means entirely the individual glomeruli will not be affected. Only what will be affected? Only there will be what will be there? There will be what? There will be patchy involvement. So patchy, while looking individual glomeruli, will see what? Patchy involvement, right? Okay, now glomerulo, yes, glomeruli is affected. And what does sclerosis denotes? Sclerosis denote that what? There is what? There is deposition of what? There is deposition of extracellular collagenous material, right? And that is what? That is our sclera, right? There is deposition of our extracellular collagenous material. Now what does this extracellular collagenous material do? This will cause what? Compression of our glomerular tuft, right? It will cause compression of glomerular tuft, right? As there will be compression of glomerular tuft, what will happen? There will be what? There will be reduction in what? There will be reduction in function of our glomeruli, right? And that is what we have, we call it at what? That is what we call it glomerulosclerosis. So yes, I think the word is clear now. Our focal, only few glomeruli, entirely total number of glomeruli are not affected. And segmental means when we watch individual glomeruli, what we'll find is we'll find only the patchy involvement. And that is what we say segmental. And glomerulosclerosis means what? There will be extracellular collagenous material deposition that will cause what? Compression of glomerular tuft, and that will cause what? Reduction in function of our glomeruli. Okay, now what are the causes of, okay, now talking about it, right? Okay, now let us go toward what? It is most common nephrotic syndrome, most common cause of nephrotic syndrome in the case of what? In the case of our adult, you can see focal segmental glomerulosclerosis. Similarly, the most common cause of nephrotic syndrome in the case of children is our minimal change disease that we memorized through the C, right? And in elderly individual is our what? Membranous glomerulopathy, right? Membranous glomerulopathy, that we'll be discussing after this lecture. Okay, now moving toward what? This disorder can be primary disorder. As you can see, this can be primary disorder, right? And this can be secondary disorder also. The primary disorder are more common, and they are idiopathic in nature. We don't know the exact cause. And talking about the secondary disorder, right? And the secondary disorder is what? We can see hypertension, that is because of obese or overweight, that is because of reflex nephropathy, right? That is because of sickle cell disease, right? That is because of unilateral renal agenesis, right? And that is also because of what? Because of it also occurs in our intravenous drug abuser, HIV individual. Okay, now as you have already mentioned that it is the most common cause of nephrotic syndrome in the case of adult, right? And what will happen here? There will be non-selective proteinuria. Now what is this non-selective proteinuria? There will be presence of non-selective proteinuria. Non-selective proteinuria means that there will be loss of what? Our protein, irrespective of its mass or what? Its charge. Okay, that means selective proteinuria means what? Only there will be loss of what? Albumin, especially albumin, because what? because the podocytes are damaged, there will be effacement of podocyte. As there will be effacement of podocyte, what will happen, there will the negativity charge on podocytes will be lost, right? Podocytes will be lost, podocyte will be lost, because of which the albumin which is normally not present in urine now will get filtered, right? Filtered, and albumin is low molecular weight protein, and it will get filtered, and because of this because of this excretion of albumin or filtration of albumin, we call it what, we call it selective proteinuria. But here it is non-selective, that means not only albumin but also other different type of protein, right, which are of larger molecular mass, they will also get filtered. Okay, now as we have already mentioned, focal, segmental. What does focal means? Focal means only few, right? Few glomeruli are only what affected, and segmental means that when we watch what individual glomeruli, what we'll see that only some segment, right, only some patch, there will be what patchy involvement, only some segment are affected. Yes, and when we just watch it through electron microscope, right, for diagnosis, we'll see the effacement of protein podocytes. As we have already said, we have discussed it many times in previous lectures. Podocytes, what are podocytes? Visceral epithelium cells. What this contains? This contains negative charge, right? This contains negative charge, and these negative charge, what they do normally, they don't allow proteins, right? They don't allow proteins, right? Proteins to what? To pass or to get filtered, right? Because proteins also negative charge, and this negative they cause it causes repelling, right? But here what will happen is that these podocytes, right, these podocytes will not be what, these podocytes will get damaged. That means there will be like this, right? There will be like this structure. If these podocytes will be damaged, then there will be no negative charge also, there will be no negative charge, because of which the proteins which were repelled because of negative charge, now what will happen, they will get filtered, right? So there is what, effacement of podocytes that cause what, proteinuria. Okay, now moving toward this structure, as we have said. Okay, let me complete this diagram. It is like this, right? Now we are just watching what, we are just watching the zoom in picture of our what, our this podocytes. Now here, yes, I have yes, let me complete the diagram. Yes, the diagram is like this, right? Yes, it is like this. Okay, it is like this. Now here in podocytes, the thing that you'll see is, you will see what, you will see nephrin, right? What you'll see, you'll see nephrin right here. Okay, the diagram is not clear. Nephrin is right here, right? And here this purple colored structure, right? This one is our podocin, right? This nephrin is what, this nephrin is because of regulation of gene NPHS1 gene, right? And how to remember it? Now in this NPHS1 gene, as you can see, there is 1, right? And the first letter of this NPHS1 gene is our N, so it codes nephrin, right? It's active it causes the production of nephrin, let's say. Now if there will be defect in this NPHS1 gene, what will happen? There will be no production of nephrin, and that will give rise to congenital nephrotic syndrome, and this is so important to know. Similarly, now we're going toward NPHS2, right? 2 gene. Now there is one NPHS1 gene that is coding nephrin, and there is another gene that is NPHS2 gene that is coding our what, podocin, right? Here this purple structure is our podocin. Now how to memorize it? Now yes, there is 2 NPHS2 gene. Now in the second alphabet of our this gene is P, so it codes podocin, right? Now if there will be defect in this NPHS2 gene, what will happen? There will be no production of podocin, and that will give rise to autosomal recessive focal segmental glomerulosclerosis, right? And that is what, the most common in what, children. Okay, it is found in children, not most common in children, it is found in children. Now, right, now moving further, what we have is, we have another right, alpha actinin 4, right? Alpha actinin 4, what it does is, right, if there will be defect, okay, what it does is, it causes the production of actin, right? Alpha actinin 4. Now because of mutation in this alpha actinin 4, what will happen? There will be focal segmental glomerulosclerosis, that is autosomal dominant variant. And what it does is, as you can see, the alpha, it seems like cross, so it does not cause renal failure, right? It does not cause renal failure, and it is so important to know. Now moving further, what we have is, we have another, okay, just a brief description about it, that is our transient receptor potassium cation, right? Transient receptor potassium cation 6. Now what it does is it causes the adult onset of FSGS, focal segmental glomerulosclerosis, that we are discussing right now. So yes, this was all about what? This was about our what? This was about our different genes, right? Okay. Now another thing that I would like to go here is now we need to know about what? We need to know about clinical manifestation, clinical feature. So what will happen here, as we have already discussed, there will be what? Proteinuria, right? Proteinuria. What will happen is that it will be okay, it will be, there will be proteinuria, but it will be non-selective, that we have already discussed, right? Now moving further, what will be found here? There will be hypertension, right? And okay, now as okay, let's not go directly into hypertension, as you have said that there will be what? There will be sclerosis, or there will be compression of tuft, glomerular tuft, because of which there will be reduction in function of glomeruli, right? Because of reduction in function of glomeruli, what will happen? Glomerular filtration rate will be decreased, and as we have now, as glomerular filtration rate will be decreased, what will happen? What will happen? Okay, okay, initially, why there is what? There is decrease in glomerular filtration rate, because there was what? There was what? Collapsing of glomerular structure, or what? Compression of glomerular structure. As glomerular filtration rate will be decreased, there will be less fluid or blood going into kidney, that will cause what? Renin activation, right? Renin angiotensin system activation, right? Now as there will be renin angiotensin system activation, what it will do is it will cause hypertension, right? It will cause hypertension. So another clinical manifestation is our what? Hypertension. Also what it will also cause, it will also cause hematuria, right? Hematuria. Now this hypertension, hematuria, decrease in what? GFR, these are also featured that are associated with nephritic syndrome, right? Nephritic syndrome. Okay, this is important to know. Now yes, there can be eventually there can be, right, if the situation worsen, then there can be kidney failure, renal failure also. Now how we will diagnose this case? Now in order to diagnose, what we'll do is we'll do kidney biopsy, right? We'll do kidney biopsy, and now as we have already mentioned that there will be a focal segmental involvement, right? That means there will not be focal, means what? There will be not involvement of all glomeruli, right? So what we'll do is we'll just pick the biopsy, or we'll make sure that the biopsy tissue contains enough or sufficient glomeruli that are affected, right? Now another thing is that okay, now for this what we'll do is we need to know the part of kidney where the glomeruli are going to affect maximally, right? And the part of kidney where the glomeruli are going to be affected maximally is our corticomedullary junction. What I'm saying? Corticomedullary junction. Okay, what I said in the case of biopsy is that what we are going to do, we are going to make sure that what? Make sure that biopsy tissue, right, contain enough amount of what? Contains enough amount of glomeruli, right? Enough amount of glomeruli, right, that are affected. And what we'll do now, enough amount of glomeruli which are affected are mainly found in the case of our where, in which region? In corticomedullary junction. So it is also important. Now what we'll do is after doing biopsy, what we'll do is there are what? We'll do our light microscopy, right? What we'll do light microscopy, we'll do electron microscopy, and also we can do immunofluorescence, right? Now in the case of light microscope, what we'll see? Now in the case of light microscope, what we'll see is, right, what we'll see is, now as you can see right here, what we'll see is, as you can see here in this area, right, in this area, this part is so pinkish, right? Here this is so pinkish, this part is so pinkish right? It is so pinkish because it is the affected part, right? It is pinkish because it is affected part. Now this pinkish color in this region, maximum in this region, shows that there is deposition of collagenous material, hyaline like material, right? Sclerosis. What we are saying, this contains what? Deposition of collagenous material, right? And that is what? That is hyaline like material. Okay, and that is what it is, right? Now similarly, what we'll do is, yes, as we have said that because of sclerosis, right? Because of sclerosis or because of deposition of collagenous material, what will happen is that there will be compression of glomerular tuft, right? So on that basis, according to prognosis, we have collapsing collapsing variant and another glomerular tip variant. What I'm saying, glomerular tip variant. Okay, there are two variant. One is our collapsing variant and another is glomerular tip variant. Now what is this collapsing variant? This collapsing variant is the one which is having poorer prognosis. What I'm saying, poorer prognosis, right? Now why it is having poorer prognosis? It is having poorer prognosis because there will be complete collapse of glomerular tuft, collapse of glomerular tuft. Okay, that's why it is having poor prognosis. But in the case of glomerular tip, as name suggests, just tip, right? So it is having good prognosis, or also we can just memorize it as this G and this G, right? Good prognosis. So now here, as you can see, what is this? Yes, talking about collapsing variant. As you can see, what is going on right here? Here you can see that it is this glomeruli is completely collapsed, right? Shows the what it shows is, there is complete involvement of glomerulo nephritis, right? Nephrotis. That means there is complete collapse of our glomeruli, as you can see, and it is having poorer prognosis, and it is found in the case of HIV infected patient, right? HIV infected patient. So similarly, the same thing is mentioned right here, right? HIV, right? HIV associated nephropathy. What will happen? FSGS, focal segmental glomerulosclerosis. There are two types. One is glomerular tip variant, another is collapsing type. Glomerular tip variant, as we have mentioned, that it is having good prognosis, but our collapsing type, what it is doing, what is happening here is glomerular damage, tubular cystic lesion, visceral epithelial cell hypertrophy. Yes, these things are happening, and it is having poorer prognosis. It does not respond to steroids also, right? And this was about our description. Now moving further, at the top, right, to look toward the content of our first aid. Now the thing that we need to focus right here is, right, okay, it is most prevalent in black people. We did not mention it earlier, right? Similarly, it can be there can be primary disorder, that is idiopathic, and secondary disorder, right? And the secondary disorder because of HIV infection, sickle cell disease, and yes, we talked about drug abuse also, right? We talked about obesity that was resulting hypertension, right? Interferon treatment or congenital malformation, right? Primary disease has been inconsistent response to steroid, right? Okay, there is inconsistent, but the secondary because we don't know the actual reason, right? And here, now moving further, now this may progress to CKD also. Now what we'll do is we'll do light microscopy, immunofluorescence, and electron microscopy. Light microscopy shows segmental sclerosis, deposition of non-collagenous, right, material, collagenous material, extracellular collagenous material, and hyalinosis, hyaline like material is also deposited. Immunofluorescence shows, okay, it is often negative but may be positive for non-specific focal deposit of IgM-C3 or complement 1. Electron microscope, as we have said, that there will be effacement of food processes similar to minimal change disease, right? Yes, this was about this is about the content of our first. Now if we look Robbins, what we'll see is, yes, there are several descriptions regarding these points, right? Okay, yes, the topic starts right here. Yes, the most common cause of nephrotic syndrome in the case of adult, right? Yes, similar as we discussed, right? It is talking about focal sclerosis, right? Okay, it is talking about different cause, secondary causes, hypertension, clinical manifestations. Now here talking about its primary, that is primary and the secondary one, right? The primary one is idiopathic, the secondary one, right, as we discussed because of unilateral renal agenesis, renal dysplasia. Okay, these are all things that we need to go through thoroughly, as you can see right here, the pathogenesis, as we have already mentioned, right? There will be what visceral epithelial cells, effacement of food process podocytes, right? We discuss about NPHS1 gene that was coding what nephrin. Similarly, NPHS2 gene that was coding what, that was coding our podosine, right? Yes, this was all about what, this was about our focal, right, segmental glomerulosclerosis. Now if you go thoroughly, I think it will be more clear. So with it, the lecture ends on focal segmental glomerulosclerosis. Wish to meet you.